This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to tell if you have arthritis in a joint. If you like this new video, we put out new content weekly, so please like and subscribe. So, arthritis in a joint, how can you really tell? Well, there's a bunch of different ways to sort of tell. One way is if you have joint pain, you can have joint pain. It doesn't necessarily mean you have arthritis in the joint. Normally when someone has arthritis, it hurts more with use. It'll hurt more in the morning until you kind of get it up and running, and kind of general sort of activities will cause it to ache. Now you can also have soft tissue issues. You can have a meniscal tear, rotator cuff tear, all sorts of other things that can sort of mimic that. So just that alone isn't really enough. Some people talk about crepitus, which means that a joint is clicking or popping. A lot of times there's like bursitis or prepatellar fluid or other sorts of things that can also click and pop. So with true crepitus, which means is what it feels like creaking when the bones are rubbing against each other, that's usually when arthritis is very severe. So just because your shoulder clicks or pops or your knee clicks or pops doesn't necessarily mean that there's arthritis in it. So, on your own, if you have arthritis in one leg and the other leg feels similar, that's a way to tell. But really the best way to tell is to get an x-ray, and that'll tell you if there's arthritis there. That's the best way to do it. If you get x-rays of your knee, or let's say, your ankle, it's good to get them weight bearing, because if you get non-weight bearing x-rays of your knee, it might look like you don't have arthritis, and then you get weight bearing x-rays and it shows that you actually do. And on x-ray, what it will show is that the cartilage doesn't show up on x-ray, but the bones do. And normally there's space between the bones on the x-ray, and then if the cartilage is worn away, that space kind of collapses until the bones kind of start touching each other. So that's essentially what you're looking for arthritis on x-rays. You'll also see other things, like if the bones are touching each other, you start to see like extra bony growths called osteophytes. You see some cysts that'll form underside of the bone, because the bones aren't really meant to be touching each other like that. And sometimes the bones will actually get more dense, so they'll appear whiter on x-ray. So again, x-ray is the best way to tell. If you're just at home wondering if you have arthritis, it's really hard to tell without that. Obviously, the older you get, the more likely you are to have it. If you had an old ACL tear or SL ligament injury to your wrist, then the probability is high, but that is the easiest way to get it. I mean, CT scans and MRIs will show it as well, but x-ray is the perfect place to start. Without that, you're just kind of guessing whether you have it or not. So I hope I was able to answer your question about how to tell if you have arthritis in a joint. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you any medical advice about your specific condition. Again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.